Good morning, everyone. This video is about the second part of Unit 7, and believe it or not, I have 5 points only, topics, issues to discuss with you. I want you to listen very carefully. First of all, those who were in our in-class session of about 2 hours, I think noticed, and you can ask them, that it's actually very simple. Think simple. We are using very basic, the word is basic, mechanisms of physiology and very basic knowledge of anatomy to break down the idea of a disease. Things are not as complicated as you think or as you're making it. Some of you, and I understand. I want to keep things simple, so this video is going to be about principles. I'm not going to explain a specific disease. We don't need to. What I want to happen is that after this video, write down during the video the simple ideas, or see it again and again. It's going to be kind of short, hopefully. And look at a disease and identify the simple mechanisms that happen. So I want to talk about principles. I'll give examples. You identify the disease accordingly. Once again, simple principles, simple mechanisms that you already know. We're just going to put them in a certain context, and hopefully you'll get it. Don't overcomplicate things, because they're not. And I'm not just saying that, and I'm not messing with your mind. And I hope to prove it today. Right? So you have a presentation of 225 slides, but if you kind of peel off the outer layers, you're going to find exactly what we're going to talk about today in there, and just try and imagine it. Simple principles. So let's talk about simple principles. The first principle that we're going to talk about are mechanical forces. The circulatory system, that the heart is the pump of that system, works on pressure and tension. Pressure of the fluids within the system. In this case, we're talking about blood. And tension of the system, that would be the vessel or the heart itself. So the myocardium, for instance, and its layers, the heart's layers. So we have the pericardium, we have the endocardium. You know the anatomy. So those are forces. Forces create outcomes. In this case, we're talking about movement. Everything here is about movement of the blood. When we do not have movement of the blood, we're asking for it in a way. Okay? I'm not saying that more movement is always better, but we need movement to occur. That means that we need those forces to be effective and to be regulated and supervised and applied to the blood, to our circulation system, according to needs, in a way that allows, and this is a major sentence, in a way that allows normal function. Now notice that I did not say at rest or at peak or max. Whatever is normal for the situation that you are in. When do we start having problems? When it's not normal. Let's talk about fluids. Fluids have one very unique, they have others, but one that is extremely important to us. Extremely important. It's in the heart of this chapter. No pun intended. Believe it or not. Fluids have a mechanical characteristics that they cannot be condensed. I want to show you something. Here's a syringe, and what you see inside the syringe, just so it has a bit of color, although it looks suspicious, it's actually decaf coffee, nothing else. Don't go there. Right? And the syringe is right now, sorry, here's the camera, is now occluded from the other side. There's fluids inside, and there is the handle, right? Look what happens when I try and condense the fluids. Nothing. You know why? Because the fluids cannot be condensed. If I push harder, the fluids will fight back, but you're not going to condense them. They are not going to move. If they're not going to move, that means that they're pushing back. If I push harder and harder, only one thing is going to happen. This syringe is going to break up, and the decaf coffee is going to be all over my notes and computer, and I'm not giving you the privilege of that today. Sorry. Now I want you to think. Once I want you to think what happens to a blood vessel with fluids inside. The syringe is now, this part of the syringe is now a blood vessel of sort, full of fluids. There's a pump behind it, in this case the heart, that is constantly pushing, trying to condense this fluids, but it has nowhere to go. You know why? Because this vessel is fully occluded, in this case by my finger. But if you look at the presentation, sorry, you will identify different processes that lead to partial or full occlusion of a vessel. It doesn't really matter why. I mean, it changes the mechanism, but the result is the same. You have a vessel, fluids in, something's pumping or pushing from behind. The heart, this represents the left ventricle, right? Or the right ventricle, if you're looking at the pulmonary circulation. This is an artery. If this is the left ventricle, this would be the aorta. And it's occluded. So pressure builds up inside the vessel. The more you try and push it, the bigger the pressure. Pressure is a mechanical force that would simply blow up this whole system when the pressure is too high. It can be the aorta, it can be any vessel. So I hope this makes sense to you, and I hope it helps you understand. And by the way, it doesn't matter how strong you are. Not going to happen. When do you not have a problem? When the fluids have somewhere to go. So right now I'm going to remove my finger, and I'm just going to push the fluids into the trash can. Here you go. No more decaf. You don't have a problem because the pressure was released. What is the takeaway from here? What do I want you to retain? The system is working with fluids. When fluids have nowhere to go, pressure builds up. It's a mechanical problem, and it's not a good idea. When we're talking about the pressure of the fluids or the solution, in this case it's also a tissue, if you remember. Within our vessels, we're talking about blood. Blood and pressure, blood pressure. Okay? So blood pressure is a mechanical force, and most of what we're talking about with the heart is going to go back to blood pressure. I want you to identify that in the presentation. If you are smart, and I believe you are, you will actually take the presentation and say, okay, this is what Moran was talking about. Here we go. Here's the word pressure. Alright? Sit down with the presentation and identify it, because it's a major thing. Okay. So let's say that we have a partial or full occlusion of a vessel. What's going to happen? Let's analyze it locally. What's going to happen at the exact area or the near surrounding of the occlusion? You have pressure buildup. That means that the vessel, with its smooth muscles, is pushing down on the fluids within the vessel, and they're pushing back because they will not let you condense them. Remember that. Not going to happen. They want to continue to flow, but they do not have where to flow except one direction, and that's outside of the vessel. So now you have pressure buildup that is pushing the fluids outside of the vessel, and that is fluid accumulation outside of the vessel, and we call that edema. But look what happened. The more buildup that you have in the vessel, the more fluids start exiting the vessel, right? So they're starting to accumulate in another place, in the interstitial space, causing edema. But there's still fluids. They're not going to let you condense them even in that space. So now they are pushing on the next tissue, and they are applying mechanical resistance and load and pressure on the next tissue, on the environment. Obviously, in addition, you're going to have irritation that leads to inflammation, and you know very well what it means to have inflammation. So let's take an example. When blood cannot flow from the left arteriole into the left ventricle, you have a buildup of pressure in the left atrium. Blood has nowhere to go, so it's going to start affecting the local area, meaning it's starting to affect the atrium's muscle. But there's only so much that you can stretch the atrium. So blood is pushed back into the pulmonary circulation. Who is it going to meet first? I hope you know the answer. The lungs. But you have a huge pressure buildup. Why? Because you have the right ventricle pushing blood forward. You have the left atrium not able to transfer the blood forward, so you have an occlusion. And in the middle, just in front of the lungs, you have a huge pressure buildup because blood is now coming back from the left atrium because it cannot go forward, and more blood is being pumped from the veins, returning into the right heart and pumped out to the lungs. So the pressure buildup in front of the lungs is getting bigger and bigger. What's going to happen? Blood is going to leave the vessel, fluids are going to leave the vessel, not blood, sorry, fluids, and you have respiratory edema. But now you have fluids building up around the lungs. The lungs want to expand, and when the lungs want to expand, they're trying to push those fluids. If the fluids could go back into the vessel, you wouldn't have a problem. So now you have fluids in the middle between the lungs pushing from one side and the pressure in the vessel pushing from the other side, and you're asking for trouble. So you feel pain. Why? Because those fluids are also pushing on nerves. And when you push on a nerve, you feel pain. Does that make sense? The whole story until now is broken down to two simple ideas. A, you cannot condense fluids. Two, if you're trying to condense fluids, pressure them, you better give them an option of where to go. When the second option does not exist, meaning they do not have somewhere to go, you're going to have a problem. So edema is the first thing to happen. But wait a minute. You still have, in our case, a pump that is trying to push blood out and encountering increased resistance. In this case, it's the right ventricle. So the blood pressure there, the mechanical resistance of the fluids in the pulmonary circulation is building up. What are you going to see? Exactly like in the gym. When you stand in front of free weights, of barbells, of that rack, and you go, should I work with the 15 pounds today or the 30 pounds? What are you actually deciding? You're deciding against how much resistance you're going to work today. That's why it's called resistance training. Blood pressure influences the resistance of the system. Now you have a ventricle that is working against increased resistance, increased workload. And exactly like in the biceps and the triceps and the pectoralis, whatever muscle you choose, that you're working in the gym with elevated mechanical load, meaning the weights, you're causing hypertrophy. But in this case, the hypertrophy is not because of a good reason. It's not that you're healthy and you're working out and life is grand. No. You have a problem in the system causing elevated workload, and that's why your ventricle or any other compartment of the heart is showing hypertrophy. At some point, you're going to fail. Let's go back to the gym. So you have that rack, and you try a set of 10 reps with 50 pounds. Not a problem. You go up to 25. Not a problem. 35. Not a problem. At 60, you're unable to function, and at some point you're just going to let the weight fall down. Meaning that you failed to function at that workload, at that resistance. That is exactly what's happening to the heart. It can come from the direction of the aorta, and then you have a problem in your left side, and it can originate from your left side and influence your right side. And then you have what we call heart failure. So it's either left ventricular heart failure, right ventricular heart failure, atria dysfunction or failure. It's the same mechanism, right? Do you remember that we're talking about circulation, about a circle? It's all connected. So you can, if you leave those situations untreated, and this is a major principle, when things are untreated, you're asking for it and the whole system is going to collapse. Because now you have a problem in your right ventricle, it's going to affect the veins. The veins go back and connect to arteries. The arteries connect to your left side. And anything in between is going to be affected. Okay? So I hope that is clear. So we have a local effect, which is edema. We have a backwards effect, and we have a forward effect. Why? you have occlusion. Blood is not being supplied. Does that sound familiar? You know what's happening, right? We're talking about, eventually, ischemia. Blood ischemia specifically is talking about oxygen, but what about all the other components of blood? What about the immune system components? The adaptive system, right? Anything in front is not getting the service of the immune system. So you're asking for inflammations, you're asking for infections. You are leaving anything in front of the system vulnerable to immune problems. What about nutrients? Make no mistake, the oxygen deficit and deprivation is by far the worst, but you have a combination of all of them. Let's go back to ischemia. When a cell does not get oxygen, what are the options? If you can't be aerobic, you're going to go to be anaerobic. Anaerobic, as you know, creates acidosis. Muscles and the nervous system are extremely sensitive to low pH, which is acidosis. So now you're taking on your muscle system, your muscular system, impairing movement with a combination of the nervous system. You want good advice? Don't take on the nervous system. It doesn't work well. It's connected to every part of the body. It can shut you down, and it can produce the worst outcomes ever. So now you have the nervous system, which is also connected to the muscular system. One word should come to mind: dysfunction. So twitches, spasms, dizziness, nausea. Do you remember that you had the vagus nerve going all the way down through your stomach? You're going to irritate it as well. So now you have an ever-growing problem with more and more systems affected, starting with an occlusion. By the way, who cares how the occlusion started? I mean, it's going to change the treatment. But the first thing that you have to understand that mechanically you have an occlusion. So obviously the presentation has more than enough examples of different reasons that lead to partial occlusion or full occlusion. But the idea is the same. After one or two steps, you'll notice that everything that I'm saying right now is going to occur. It's like a domino effect, because everything is connected in a circle. In this case, either the systemic circulation or the pulmonary one. So it's just a matter of time, once again, if untreated. If untreated. Okay, so blood pressure, mechanical resistance. Major idea. Let's continue with the anaerobic metabolism. What would be the outcome of a severe situation where it's untreated and perfusion of oxygen is lowered or cut off? Shock. So you have all kinds of reasons of shock, but that would be one of them. Okay. Continuing with the idea of pressure. When you have that buildup of pressure, as we said, it's going to also affect the nervous system, which is everywhere. So you feel pain. But in addition, if something, anything, a cancer tumor, a muscle, fluids, either resulting from an inflammation, edema, you name it, thrombosis, that are pressuring the heart, you're going to feel it because the heart wants to expand. The lungs want to expand, and they're focused here in your chest, right? In the thoracic cage. And you're pressuring against it, and in the middle you have nerves. You're going to feel pain. How do we call that pain? Angina. So you have different kinds of angina, and the symptoms appear at different times. That's up to you to read in the presentations. But that is the mechanism. Does that make sense? So you're feeling pain, and you can feel in severe angina a sensation as if you're being crushed. That is a word that appears again and again and again with people that felt that. Remember that, the word crush. Some say that they felt like a truck was sitting on them, and some say an elephant. But they're using something huge that would crush you to explain the pain. So you have stable and you have unstable, and symptoms come and go at rest or not. But that's the mechanism. Okay. If we're talking about blood pressure, one of the ways to lower the pressure in the system is to decrease to a certain point the amount of fluids. If you retain fluids, you're elevating pressure. Why? Let's connect the dots. Because those fluids are not willing to let you condense them. Yeah, I said it 1,000 times, and I'll say it again. Whenever you decide to get it, we're cool. Who has a very good control over the volume of fluids? The renal system, the kidneys. So when they function normally, that's great. If you have a problem with the renal system, it's going to affect the blood circulation. Thus, I hope you already know that it's going to affect the heart and the lungs. Why? Because you're connected in a circle. Basic anatomy. Now, obviously, you have two processes. You can retain fluids by different means. Sodium, ADH, constriction of the renal vessels, changes in the nephron, decreasing the volume of urine, or you can increase the loss of fluids. It can also happen for the wrong reasons. When you vomit, when you puke, over urinate, sweating, and so on and so forth. You're losing fluids. Balance. So if you're losing fluids and it's causing a problem, you have basically 3 options to correct the situation. One is intake of water. Drink, not pop, water. 2, you can retain water, meaning that you exert less. And the third one is medication. So maybe you need help with it. So that's kind of the second option, only with a bit of help from the outside. Okay? So yeah, the renal system equals volume control or fluid control, and by that you're playing with blood pressure, and you already know what blood pressure means. Let's see. Let's talk about dysfunction. Once you have a dysfunction, the problem is that it's going to spread very fast, relatively fast, if it's untreated. Once again, if it's untreated. When you have more than one organ affected, That is a process or a condition that we have called multiple organ dysfunction. And that is bad. It's bad because it means that the problem is not local anymore. Right? Let's talk about infections. Infections lead to a immunoresponse, right? Hopefully, it's a good response. What response? Inflammation. Are you tired of saying inflammation? I'm not tired of saying inflammation. I hope you're not tired of saying inflammation. Want to say inflammation together? Inflammation causes a buildup of fluids. Well, for instance, if you had an infection or a mechanical inflammation that causes a buildup of fluids in the pericardium, which encloses the heart, what's happening? You're elevating the mechanical resistance to the wish/will of the heart to expand. If the heart can't expand, you're losing elastic power and contractility. I hope by now that you know that that means that SV is going down. SV is going down, EF is going down. Function is going down. At first, you're going to have elevated resistance. So that might lead to hypertrophy. At the end of the day, hypertrophy at some point comes to a point where it's just dysfunctional, because the resistance to the injection of blood is too big. So here's the connection between inflammation, fluids, the mechanical characteristics of fluids, and cardiac dysfunction. And you'll see that mechanism again and again and again. And edema, and so on and so forth. Did you ever ask yourself, why do we have, if it's so bad, why do we need fluids when we have inflammation? It's very simple. Because you have heat production, and heat production will kill the cells. So one of the ways to take out a fire or a bonfire is to pour water on it, right? Why? Because the water absorbs the heat. If you have fluids that can absorb the heat, less cells are going to be damaged. What is the idea of our response? To decrease as much as possible the number of cells that are going to be affected or die. So if you have a heat problem, you bring in water, you bring in fluids. But when you bring in fluids, you're dealing with their characteristics. Let's talk about the sympathetic nervous system and its hyperactivity. The sympathetic nervous system, when we're talking about vessels, is going to increase blood pressure by vasoconstriction. It's going to increase heart rate. It's going to increase cardiac output. But when you have a block in the system, an occlusion, that's not a good idea. We want to lower blood pressure. We want to open the occlusion, either by drugs, right, medicine, or a mechanical option, that would be surgery, for instance. And we need to lower cardiac output to lower the mechanical load of the system. But when your sympathetic system is hyperactive, that's not what you're getting. You're getting the opposite. And once again, it's starting from the nervous system, but immediately through vasoconstriction, you're elevating blood pressure, thus you're elevating mechanical load, and all the outcomes that we talked about: hypertrophy of the ventricles, edema, ventricle dysfunction or failure, and so on and so forth can occur. When you injure tissue, as you well know, and I know that you well know, I know who taught you, you might be dealing with scarring of the tissue or remodeling or both. In both cases, you're losing functional ability. So here we go again. If you're losing functional ability, you're losing most likely at some point the ability to locally or systematically control blood pressure. Low blood pressure will lead to dysfunction at almost exactly in the same mechanism, only in this case you don't have the power to push blood. So it's going to accumulate at some point, and it's going to start affecting the local area, anything behind it, and anything in front of it. So high blood pressure, not good. Low blood pressure, if they affect function in a non-positive way, in a negative way, is going to lead to all these problems. So that's it. 37 minutes, more or less, give or take a bit. Go over the presentation and simplify things. What is the origin of the problem? How does it lead to a problem in this circulation system? And now identify how it's going to affect you locally, backwards, forwards. I hope that helps. Keep it simple. Do yourself a favor. Keep it simple. Alright? Of course, as usual, I'm going to warn you that quizzes and exams don't necessarily pertain only to what I said in the video, and you are advised to read the book, go over the whole presentation, and communicate any needs, concerns, and questions that you have. Have an awesome day. Goodbye.